Testosterone naturally starts declining, we know, in the early 30s, especially for men, but I am seeing men younger and younger with low testosterone, and I think it's a combination of stress, lifestyle factors, sleep, exercise, nutrition, alcohol intake or sugar intake, those kind of things, as well as toxin exposures, depending on their job and so forth, right? Just things we pick up every day. The struggle with this is that usually the symptoms are not necessarily the classic symptoms that we all think of as far as low libido. I think that's the first thing people think of when they think of low testosterone. And for a lot of men, especially younger, the libido is the last to go, but the energy will drop. And the motivation, they get off work and they just feel like sitting on the couch and not doing anything, not playing with the kids or whatever they normally enjoy doing. I think the good thing is there's a lot more that we can do with these young guys besides just say, hey, work on your nutrition, work on your lifestyle, start exercising some more and those kind of things. It doesn't really do these guys a lot of good to tell them that. You may get a 100-point increase or so, but you're not gonna make a substantial increase. There are a couple of options besides just going straight to testosterone therapy, and that's really what I wanted to talk to you about today. There's two of them. One of them is called Clomiphene. The other one is called HCG for short. I won't try to spell out the name for you. But both of these medications are testicular stimulators. So you're basically just trying to get the wiring from the brain to the testicles to reboot so that the body functions better naturally. Usually men are on these type of treatments from anywhere from 3 to 6 months and then take a break. And then just depending on how things progress and go, sometimes they don't need anything for months or years. Other times they take a few months off and they feel like, okay, levels are declining again, and so we just move them to a maintenance phase. Definitely doable. I also have young guys that didn't work, so we're on testosterone replacement, which is okay. But if you can keep testosterone at an optimal level without replacing testosterone, that's a more natural thing to do. So that's really where Clomid and HCG, or Clomiphene and HCG, come in great. So we do these protocols all the time. If your spouse is in the situation and you're noticing it, or if you yourself are watching this and you're feeling low energy, kind of couch potato syndrome, lack of motivation, you're not recovering as well as you used to from exercise, you're carrying a little extra tire around the waist, those are symptoms that you definitely could be having low testosterone, and it's okay if you've already had it checked and your doctor said you're in normal range. If you are below 750, 700, 650, then you are deficient. You're below optimal, especially for your age. Around the age of 30, your testosterone levels should be between 750 at the low point, and really most guys should be around 1100. That's where they feel good. Health is good, and there's not a danger point to being at that level as long as you're well monitored and you've got balance in your hormones. So anyways, if you are in need of getting your labs checked, your hormones checked, or getting an opinion about your condition, or spouse, loved one, whatever, we're here. We would love to help.